Hey guys, Dr. Derry here, owner of Revision Health Services here in Jacksonville, Florida. And today I want to talk about hip pain versus back pain. Do I have one? Do I have the other? Do I have a little bit of mixture of both? I think it's important as we move through and try to relieve those things, we try to figure out where the pain's coming from. So if you want to know hip pain versus back pain, hang with me and here we go. All right, guys. So every single day I treat back pain. Like that's what I love to treat. I help people with many different types of back pain, but sometimes the pain is in the buttock area, like off to the side and into the buttock. And I'm like, ooh, interesting, because the referral patterns for hip pain and back pain start to mix. And so coming from your back can go into that area, coming from your hip can go to that area. So I really start to become a little detective and we work through it because what you feel is very important. And I want to try to figure out if what you're feeling is coming from your hip or back so we can help direct our treatment. And so hip pain versus back pain. Now we know the referral patterns cross over a little bit. When we think back pain, we think kind of in the middle of your back, lower back, can be central or off to the sides a little bit. And what I mean is it's typically from your butt up. And so it really doesn't go past your buttock or your gluteal folds. And sometimes it does if you have more nerve issues, but right, that may not be coming from your back only. So we're going to leave that out of here. And so hip versus back, we're sitting in the middle of the back for the back, but then we start going into the glutes and then we are working into the glutes. And then we know the glutes are in your hip, right? So the glutes are the back part of your hip that helps support many things you do in our life, super strong muscles. But when we look at hip pain, we look at inside the joint or outside the joint, right? Outside the joints, more of the glute stuff in the back, right? Maybe hip flexor, TFL, piriformis. I'm sure you've heard those terms before. Outside the joint, inside the joint, labral issues, osteoarthritis, inside the joint stuff. So outside the joint, hip inside the joint. How do we figure out the difference? Is it coming from your back, from your hip, blah, blah, blah. Okay. And so one little test that I like to do is a seated test or doing lying down, help figure out, is this coming from inside my hip or outside my hip? Or do I not feel it anywhere in my hip? And is it coming from my back? So I want to run through that. Hang with me. You're going to love it. Let's work through it together. All right, guys, so we're still running through hip versus back. And so this is one of my favorite tests to do. It's very sensitive, which means it doesn't miss very many pathologies or things going on. But where you feel it's definitely important. And so you can be seated. It can have a back. It doesn't need a back. You could do it lying down as well. But what we're going to do is we're going to cross this leg over. Now, a lot of people think this is a piriformis stretch. Definitely is. But if you've ever done it and not felt it into your glute, ooh, it's time to do some more digging, right? And so as we're being a little detective about our body, if we feel it in our glutes, in our piriformis, and we're having pain or discomfort in that area, and we do this and we feel better afterwards, significantly better, then you're on the right track, right? You're hitting some piriformis stuff. You just have some tight hips. Could be from doing too much for too long, maybe not have as much strength as you need. Now, as I sit here, and I can change three different things. I can change how much pressure. Yep. I can move into an oscillatory movement, or I can lean forward and really just start diving into it. Now, compare side to side. And so for me, you can see the height here, right? My hips are fairly level, fairly good. I would say, as an unbiased opinion, my hips are a little stiff, but not bad. Now, as I move to the other side, like you can automatically see the hip difference. This is way more stiff. I'm feeling it a little bit differently. And so as you sit here and do this, if you feel it into your piriformis, awesome. You feel it in your buttock muscle, enjoy that. Do those three things, right? The oscillatory movement. You can do the increased pressure. You can lean forward. You can play with all of those. If you press down and you're feeling it more in the front, that's when things get a little more dicey, right? And so it could be from inside the hip joint. It could be a tight hip flexor, but it's definitely more likely from your hip than your back. And so that's when we start going into some more testing and looking through things. It still would be probably included into your plan or the things that we do to make you feel better, because that's just not normal range. But it may not be the thing that solves your problem, okay? And so you can still do the stretch, still very good. So apply the three different things, work into that good hip stretch, and maybe coming from inside the joint. But if you're not feeling any change in your buttock symptoms, or you're noticing that your back is a little bit achy when you do that, and maybe from your back, right? And so we start working through some movements like that to try to figure out where the pain is coming from or where the limitations are coming from. Now, this is joint mobility, and so it helps improve the range of motion of your joint. And so you can do this multiple times during the day, just hang out there and oscillate and work into it. It's good for you. It feels really good. I can tell both my sides of my hips do it. I just don't necessarily dedicate the time to do it. But hip versus back, right? The referral patterns are very common, are also very overlapping. Back pain is more common than hip pain, but doesn't mean you can't have one, either, or both of them. And so I hope you can take a little bit from this information, work into that stretch, work into that testing a little bit. Maybe it can help you decide like where you spend a little more time researching, or what you tell your physician or your physical therapist or your chiro or whoever you're working with. And then you can just kind of get yourself on the right track and feeling better, right? It's the nuances, those little things that I was telling you about, the little cues that you don't necessarily read elsewhere, but are also very important. So if you want to know more about hip versus back pain, check out in the description. I'm going to post a little link to a webinar. It's going to be something that you can just go to and access on your own time and just kind of take a look if you could pull anything from it. Lots of nuances, lots of details that kind of help you step by step to figure out what's going on and how to make yourself feel better. So I hope you can take something from this. Hope you're having a great day. Work into those stretches. Until next time, stay healthy, keep moving, and just take care of yourself.